About a mile off the coast of the Bronx in New York City is a narrow piece of land just 1 mile long. It's called Hart Island, and it's home to the largest public cemetery in the United States, where over 1 million people are buried. Despite the island's close proximity to New York, it's never been easy to access. And over the decades, it's developed a reputation.
To certain children, they were told it was a place you would never want to go because it meant that you was unloved. That was where they put people who had nobody. To find out that your loved one got put in what has been nicknamed as the Potter's Field for New York is a truly bitter pill to swallow.
In April 2020, when the first wave of coronavirus swept through New York City, the island made national news for some grim scenes.
The mass grave being dug for coronavirus victims at New York City's Potter's Field.
Acknowledge they are burying unclaimed bodies on Hart Island.
And the bodies are expected to continue to stack up.
Since then, thousands more have been buried on Hart Island, while the city has been working to revitalize its image. So how did this island become a massive burial ground? And can its reputation change? Burials on Hart Island date back to the Civil War, when it was a training ground and prisoner of war camp for the Union Army. Soldiers who died were some of the first recorded people to be buried here. Shortly after the war, in 1869, the city formally established the northern tip of the island as a cemetery, where they would bury bodies of New Yorkers who had no family members to organize burials for them. The first civilian burial was Louisa Van Slyke, who didn't have any relatives listed on her death certificate.
She was an immigrant, and she was a housekeeper, and she was 24 years old.
Melinda Hunt created the Hart Island Project, an organization that researches and provides information about burials on the island.
She died in the charity hospital, probably of infectious disease, which was much more common in the 19th century.
Mass burials officially started here in 1875, with over 1,800 burials in a single year. And the city expanded on who could be buried there, to include fetuses, infants, those who couldn't afford a private burial, and even people who chose to be buried on Hart Island. The island's operations were run by the Department of Public Charities and Correction, and when the agency split in 1895, the Department of Correction assumed full control. During the 1918 flu pandemic, burials regularly hit over 5,000 per year, and mass burials where caskets are stacked in trenches were common. The cemetery didn't take up the entire island, though. The city also built a hospital for the chronically ill, a reformatory school, and a prison. And during the Cold War, a missile storage site. Because of this history, Hart Island is often mischaracterized as an island full of New York's unwanted and unloved. But mostly, it serves as an essential part of the city's infrastructure.
New York City is a very diverse big city, and every community has somebody buried there.
The Hart Island burial process hasn't changed much since the 1800s. After a death, the Office of the Medical Examiner makes an attempt to contact family members. If they can't reach anyone, morgues prepare the body and put it on a ferry with others to Hart Island. Then workers unload individual pine caskets from the ferry, dig a trench, and either place it next to or on top of others. Finally, it's covered in dirt and grass, and its location is added to Hart Island burial records.
When I look at those images, I see a very orderly burial process. There aren't monuments that indicate that somebody was more important than anybody else. Everybody's buried in exactly the same way.
According to experts, the city did a decent job of maintaining burial records, until a fire struck the island in the 1970s. It destroyed some records, and New York's municipalities struggled to create a new system quickly. And this happened as another health crisis was on the horizon.
AIDS, acquired immune deficiency syndrome.
We're talking about a potential massive epidemic.
AIDS could become one of the top 10 causes of death in the United States.
New York City was hit especially hard by the AIDS epidemic. Thousands were buried on Hart Island as a result. And the cemetery, previously confined to the northern tip, expanded farther south. Since the record system was broken, it was nearly impossible for people to determine where or if their loved ones were buried on the island, until a public database was created in 2013. But Hart Island has issues that go beyond record keeping. For most of its history, the island has been run by the Department of Correction, the agency usually in charge of the city's jails. Many other cemeteries in New York City are run by the Department of Parks and Recreation, an agency with expertise in landscaping and tourism. For years, the city relied on the DOC's inmate labor for burials, instead of hiring much-needed landscapers to fix areas of disrepair on the island.
Currently, the buildings on Hart Island are unstable. They're contaminated with asbestos. These are very, very sacred places to people. The buildings are getting in the way of people remembering the lives of their relatives, their friends.
Plus, grave markers don't provide much information about who's in the island's mass graves. Another major problem is erosion along the coast of the island. A CBS report from 2018 and the Hart Island Project found exposed decades-old skeletons along the coasts. The DOC also facilitated visitation to the grave sites, but hasn't made it easy to visit. The island is only accessible by ferry, and the DOC only allowed a few visitor appointments per month. All of this is why today Hart Island's dark reputation persists.
I sort of feel that the city, in not talking about it, has made it seem a lot darker than it is.
Hart Island's existing issues compounded during the coronavirus pandemic, when the city sent a flood of unclaimed bodies. In 1988, at the height of the AIDS crisis, there were over 1,500 burials on Hart Island. In 2020, there were over 2,000. One of these people was Roderick Paulus, a postal worker and toy collector in New York City, who died from presumed COVID-19 on April 18, 2020.
Well, I spoke to Roderick in early April.
Anita Perry was Roderick's best friend for over 30 years.
It was unusual because you never really hear him fatigued. He's always upbeat, happy, charismatic. But this day he sounded a little tired. He was coughing and he kept clearing his throat. And I kept asking him, is he okay? He said, I'm fine, sis, don't worry about it. I said, no, something sounds a little odd to me.
Since the pandemic started, the medical examiner's office has been making thousands of calls a week trying to find next of kin. That's how Anita found out what happened to Roderick. After 4 days of unsuccessfully trying to reach her friend on the phone, Anita received a call from a detective at the city's medical office informing her that Roderick had died. He didn't have any living family in the US, so he always referred to Anita as his next of kin.
Roderick became more than a friend. Roderick became a brother to my family. He was like my mother's son she never had. He became godfather to my children.
Detectives didn't give Anita the option to claim his body because she wasn't directly related to Roderick. Instead, he was buried on Hart Island, around here, in plot number 411.
We have no access to Hart Island, so for me, it was heartbreaking. It was my biggest fear come true.
A closer look at the data reveals a pattern of who was sent to Hart Island during the pandemic. These neighborhoods sent the most people to Hart Island in 2020. Some of them had the highest death rates in the city, and they're low-income neighborhoods with an overwhelming majority of Black and Latino residents and frontline workers who often don't have access to healthcare. These are the people most likely to be buried on Hart Island. Roughly 1 in 10 of New York City's COVID victims will be interred here.
They're not statistics, they're not numbers. These are people that we loved.
Now going to continue with the hearing on the signing for a package of bills that really rethinks, reconceptualizes the way that Hart Island operates. We're at a point now where we're going to do things very differently.
A few months before New York City became the US coronavirus epicenter, Mayor de Blasio began to move Hart Island's jurisdiction from the Department of Correction to the Department of Parks and Recreation, and tasked them with making the island easier to visit by increasing ferry service. The city is also working with landscaping companies and federal agencies to address erosion and keep cemetery grounds clean and organized. Politicians have proposed adding a COVID memorial on Hart Island in the hopes that the island can become a more welcoming place for grieving loved ones.
So there's no reason that people should fear a city burial. In fact, we should celebrate it. And the more people feel that it's a good choice, the more that's going to help the people who didn't really choose a city burial to feel better about what happened to their relative.
Everybody needs a place to go to say goodbye. But right now, I know for a fact, my place is Hart Island, and I want access to it. I want a memorial put there for my best friend. Because I'm telling you, to heal New York, that's where it starts.
We produced this video in collaboration with the Stabile Center and a New York City nonprofit news organization called The City. COVID-19 has already taken the lives of over 30,000 New Yorkers, and the city has been working really hard with local journalism schools at Columbia and CUNY to honor people like Roderick. Last year, they launched New York City's first searchable COVID-19 memorial called Missing Them, with more than 2,000 names and counting. By going to this website, you can see their digital memorial with moving stories and photographs, along with strong accountability reporting on the pandemic's toll in New York. And if you lost anyone to coronavirus in New York and want to share their story, please fill out the form in the description below. Thank you all for watching.